Hello everyone. Today we'll discuss the part 65 of the NEET quiz important questions, and today we will discuss the questions of the topic urinary bladder and the pelvis region. So first try to answer the questions by yourself. Adult urinary bladder is which region organ? So in the adult it is the pelvic region organ, while in the children urinary bladder is which region organ? So it is the abdominopelvic region organ. Now supply of the ureter are derived from which spinal segments? From the T12 to L1 and from the S2 to S4. Which muscles lies between the posterior and the middle layer of the thoracolumbar fascia? So it is the erector spinae muscle. Which muscle lie between the anterior and the middle layer of the thoracolumbar fascia? So it is the quadratus lumborum muscle. Thoracolumbar fascia gives origin to which muscle? It gives origin to the transversus abdominis and the internal oblique muscle. Lumbar plexus lies within which muscle? So it lies within the psoas muscle. In children, neck of the urinary bladder lies at which level? At the upper border of the pubic symphysis. In adults, neck of the urinary bladder lies at which level? At the lower border of the pubic symphysis. What is the shape of the urinary bladder when the bladder is empty? So it resembles as the tetrahedral shape. What is the shape of the bladder when the bladder is full? So it resembles as ovoid shape. What is the capacity of the urinary bladder in the adults? So it is about 120 to 320 ml. Median umbilical ligament is attached to which part of the urinary bladder? So it is attached to the apex of the urinary bladder. Median umbilical ligament is the remnant of the urachus. Posterior surface of the urinary bladder in the males is related to which structures? It is related to the rectovesical fascia, coils of intestine, vas deferens and the seminal vesicles. Posterior surface of the urinary bladder in the females is related to which structures? Rectouterine pouch, cervix of the uterus and vagina. Which is the most fixed part of the urinary bladder? So it is the neck of the urinary bladder. In males, neck of the bladder rests on the prostate. In the females, the neck of the bladder rests on urogenital diaphragm. True ligaments of the urinary bladder are, so they are lateral ligaments, puboprostatic ligaments and the posterior ligaments are the true ligaments of the urinary bladder. Which are the false ligaments of the urinary bladder? So these are median umbilical ligament, medial umbilical ligament, medial umbilical fold and the median umbilical fold. The apex of the urinary bladder develops from proximal part of the allantois. Vesical venous plexus is seen in which ligament? In the posterior ligament. Neck of the urinary bladder is fixed by which ligament? By the puboprostatic ligament. The floor of the rectopubic space is formed by which ligament? By the medial puboprostatic ligament. Medial umbilical fold is covering over what? It is the covering over obliterated umbilical artery. Median umbilical fold is covering over what? So it is the covering over urachus. So medial umbilical fold is the covering over obliterated umbilical artery and the median umbilical fold is the covering over urachus. Uvula vesicae is small elevation produced by median lobe of prostate. What is bar of Mercier seen in the urinary bladder? So it is the interureteric ridge. What is muscle of Bell which is seen in the urinary bladder? So it is urethral ridge. Describe the trigone of the urinary bladder. So it is the most fixed part of the urinary bladder and most dependent part of the urinary bladder also. And the trigone of the bladder develops from the mesoderm. What is the arterial supply of the urinary bladder? Superior gluteal artery. What is the root value of the nervi erigentis? So it is S2, S3, S4 parasympathetic nerve supply. What is the function of the nervi erigentis? So it forms the spinal micturition center and it is motor to the detrusor muscle. Which nerve is motor to the external urethral sphincter? So the pudendal nerve is motor to the external urethral sphincter. What is the function of the sympathetic fiber of the T11 to L2 spinal segment? So they are inhibitory to the detrusor muscle and they are motor to the sphincter vesicae. So today up till here, we'll discuss about the further important notes and questions of the further important topic in our next video. Thank you so much.